partition survival model is used very commonly within oncology modelling, so for that reason you may be familiar with it, some of you listening today, and it is inherently a cohort approach because, as the name suggests, the whole population are partitioned into different health states. So it's worth mentioning that it can also be referred to as an area under the curve approach as well. What happens in a partition survival model is that a cohort are followed through time as they move between a set of mutually exclusive and exhaustive health states, which sounds familiar from the Markov model. However, the difference versus a Markov model is that the partition survival model estimates the proportions in each state based on a set of parametric survival equations. So one of the reasons that it is so frequently used in oncology is because it can utilize the endpoints that are commonly collected in clinical trials, such as overall survival and partition survival curves. So if you look to the example on the right-hand side, this is exactly what we've shown here. So using the overall survival and progression-free survival curves, the cohort are partitioned into 3 sections, as you can see from the color coding. So above the overall survival curve are the patients who have died, and underneath are those who are still alive. And then of the patients who are still alive, this is further proportioned into 2 separate sections. Underneath the PFS curve is the progression-free patients, and the difference between the overall survival curve and the progression-free survival curve gives you the patients who are alive and have progressed. So this is a very simple way of using these 2 curves to partition the cohort into these health states. And what we would also typically need to do is to extrapolate the curve. So these data would be available from a clinical trial, which may, for example, only be for 1 year duration, and then we extrapolate these to be able to estimate the long-term health effects of the intervention. What we would do is use different distributions and have options available. So these would typically be Weibull, Gompertz, Gamma, log logistic, and log normal. Survival modelling, again, is a different topic, but just to give you an overview of that's the approach that's taken here. So the strengths are that it's widely used in oncology modelling and allows the oncology-focused endpoints to be easily incorporated so that the data from the trial, which typically is the overall survival and the progression-free survival curves, can directly be used, which is the main strength. The limitations are, and it's more of just something to be aware of than a limitation, is that it doesn't include the ability to transition to an improved health state from the current state. So this means that in this example, patients can't move backwards from the progressed disease back to progression-free. So it's important to make sure that assumption holds. And of course, this approach can be used in other disease areas as well, where the cohort can be partitioned into different